Sudden cardiac arrest is one condition that contributes to significant mortality in the adult population. Today, it remains the single largest categoric cause of natural death. In the Philippines, it accounts for 10% of all deaths. It can happen at any time, to anyone, anywhere, and although pre-existing heart disease is a common cause, it may strike people with no history of cardiac disease or symptoms. The Boston Children's Hospital, Harvard Medical School, and Pendar Technologies developed a laser-based device that can predict cardiac arrests by determining whether or not living cells are receiving enough oxygen to remain healthy and function properly. The lack of oxygen is crucial because living cells contain mitochondria, which requires oxygen to make energy. Individual cells can suffer damage or death without enough oxygen, which in turn can lead to the failure of living tissue structures such as organs. This can be monitored by changes in the wavelength of the laser scattered light as a function of the changes in mitochondrial redox states, in this case, on the epicardial surface of the heart. To give a more in-depth explanation, we can go back to the electron transport chain, or ETC. Oxygen is used within the mitochondrion to produce energy via aerobic metabolism. When oxygen delivery to the mitochondrion decreases below a critical level, the flux of electrons is diminished. The effect is that the concentration of proximal reducing agents increases. This is measured using resonance Raman spectroscopy. The technique involves shining a monochromatic light source, or a laser, on a sample and detecting the scattered light. A portion of the scattered light is shifted in energy due to interactions between the incident electromagnetic waves and the vibrational energy levels of the molecules in the sample, called inelastic scattering. In this case, the wavelength is shifted to lower energy when it interacts with the target mitochondrial cytochromes, called the Stokes shift. Based on the shift, you can calculate the 3-RMR value, which is the ratio of the reduced ETC cytochromes to the oxidized ETC cytochromes. A 3-RMR value of 40% predicts a cardiac arrest in the next 10 minutes with 95% sensitivity and 100% specificity. Here are some of the lab results. The researchers developed a spectral library to accurately get the spectra of oxygenated and deoxygenated mitochondria without interference. To determine the ability of 3-RMR to predict impending myocardial dysfunction and cardiac arrest, rats were exposed to severe hypoxia after a period of stabilization. As tissue oxygen tension, or TPO2, decreased, 3-RMR increased from baseline levels of 25% to greater than 40%. Beyond 10 minutes, the percent survival of the patient continues to decline as seen in the last graph. Right now, we don't have a patent for this technology yet. What we do have are these two relevant patents. One is a method in an apparatus for the non-invasive dynamic tracking and diagnosing of cardiac vulnerability to ventricular fibrillation, where T-wave alternance and heart rate variability are simultaneously evaluated. In this other patent, we have a method of automatically determining which type of treatment is most appropriate for a cardiac arrest victim by transforming one or more time domain electrocardiogram, or ECG, signals into a frequency domain representation. In its current state, the instrument still has a lot of limitations. It has to be downsized in order for it to be portable, and it should be able to send notifications for help. However, this work provides a platform for the future interrogation of mitochondrial function in human tissues with applications in diverse fields of medicine. The technique may be used to monitor tissue viability during surgery, as well as the protection of organs. Mitochondrial function is also central to cancer biology, myopathies, aging, and mitochondrial diseases, for which a non-invasive mitochondrial probe could lead to new avenues of research. This could also help in facilitating drug discovery.